Welcome to Retina, where Retina conversations happen. I'm Scott Krzywonos.
And I'm John Kitchens.
John, we just got back from Dallas, Texas. We were down there for the Cencora Vision Exchange meeting. This is not a meeting that was on my radar prior to starting this podcast with you. Can you tell the audience a little bit about what the Vision Exchange meeting is from Cencora?
Yeah, so this was the third year that they've done the Vision Exchange meeting. This meeting is really focused around practices that use Cencora or Besse, as it's kind of known. We'll get into that in just a little bit. As their distributor, they bring in practices. Most of it's practice managers. There were some physicians, some billing office and front office people there. Some of the Besse or Cencora people that work directly with these practices, particularly around drug acquisition and drug distribution. And then interestingly, there were some people there from pharma. So you kind of brought all three together to try and analyze hey, what are some of the issues that we have presently? What are some of the ways we can work together better? And then what are some of the future challenges that we may have? It's a really fascinating meeting. It's evolved very quickly over the last 3 years to the form that it is now. And I think it's actually a really valuable thing. And I enjoy going there because it gives me a little bit more of that business perspective.
John, who is a Cencora member? What does that even mean?
Yeah, so Cencora, or it was formerly known as AmerisourceBergen, is a drug distributor. And they do more than just drug distribution. And we'll talk about that in just a bit in our interview. But basically, they're the middleman that kind of facilitates the interaction between the pharmaceutical companies and the physicians and physician offices that deliver the drugs.
You know, the more I was at the meeting, the more I realized it's not even that they're just a middleman, right? Which sounds like rent seeking. They're the ones that are facilitating the logistics of how Retina operates. If they weren't there or somebody like them was not there, I'm not quite sure how A would get to Z. They seem to be B through Y of the alphabet, and it's much bigger than I imagined.
Yeah, they deal with cold chain storage, distribution, some of the billing and reimbursement issues that we have. I mean, they just are phenomenal with all the things that they do. And correct me if I'm wrong, but I think AmerisourceBergen is actually like a Fortune 10 company. So this is no small operation. This is actually big time. And this meeting is specifically for Retina practices.
Now, we spoke with Eric Besse, who's the VP and General Manager of Besse Medical, which is a Cencora company. Just to be clear, they are one of the sponsors of Retina. But John, you walked through this interview without giving, Eric a chance to break down his questions or edit anything, right? We treated him like anybody else.
Yeah, first of all, thank you to Besse and Cencora for sponsoring this episode. But in no way did they influence any of the questions. Eric was very open about, hey, just come and ask me whatever questions. And we had a real great chance to get to know this person who is really so influential behind the scenes in how things work. And I thought it was a really great interview. Got to learn about some of his origins and a little bit more about the company.
Well, audience members, strap in and you're going to hear John's interview with Eric Besse, the VP and General Manager of Besse Medical.
Well, it's my great honor on the Retina podcast to welcome Eric Besse. Now, Eric's not a retina specialist, but Eric is very important to Retina, probably the most important man in Retina, because he deals with getting us our drugs that we use every day to help patients see better. Eric Besse, VP and General Manager of Besse Medical. Thanks for joining us, Eric.
Thank you. Thanks for having me.
So, Eric, tell me, what is a distributor?
So a distributor, so we consider ourselves a specialty wholesale. You'll hear terms like wholesaler, distributor, specialty distributor, and we're kind of all of that. But basically our role is to get product from the manufacturer to your office. We are think of us as the logistics partner of the manufacturer. So Regeneron, Genentech, Apellis, Astellas, we're buying product from them. We're taking title to the product. We're storing that product in our distribution centers, and then we're redistributing that product as your office is acquiring or buying it.
And what's the real advantage to having a distributor? Why don't we just buy the drugs straight from the manufacturers?
Yeah, that's a good question. I mean, so manufacturers, there's a couple things that we do that manufacturers traditionally don't do. Number one, manufacturers aren't necessarily structured to be distributors. There's a lot that goes into, from a regulatory perspective, licensing. We're not just shipping the product. We're responsible for the accounts receivable. So So manufacturers typically don't want to be involved with having to collect on, invoices and payments, things of that nature. So, the way we get reimbursed is for moving product from point A to point B, being responsible for the accounts receivable, any type of data that the manufacturers need from us on, where we're shipping product to and who we're shipping product to. Yeah, I mean, at the end of the day, we're part of this whole ecosystem that essentially enables pharma to get product down to the last mile location, which is your office. Within, Eye Care Partners, for example, there's dozens and dozens of different office locations. Our job is to make sure all those locations are set up, they're licensed correctly, they're rostered to the GPO correctly, we have the correct price loaded, and then at that point, we are shipping product to your office every day, next day air by 10:30 in the morning.
And you guys aren't just doing this with ophthalmology.
Correct.
You're doing this with everything. So what are some of the other areas that Besse covers as far as distribution of drug products?
Yeah, so we consider ourselves every specialty except for oncology. And I say that because there's two different specialty distributors within Cencora. There's Besse Medical, and then there's Oncology Supply. Oncology Supply, both companies were acquired about the same time, which I can go into later. But so we manage everything from obviously retinal surgery and ophthalmology to infusion. We call infusion, which is everything rheumatology, gastroenterology, pulmonology, neurology, any specialty where they're infusing drugs in the office to the patient. We have a urology team. We have a orthopedic team, which focuses on like the HA injectables, like knee injections, long-acting corticosteroids. And then we have, last but not least, we have a primary care, mental health, behavioral health team.
I'm not going to ask you what your favorite is. What's your favorite specialty? We just are going to assume it's ophthalmology.
It's by far our biggest market that we service.
Is ophthalmology.
Yes, and it's near and dear to my heart and our company's hearts. We have we've made a lot of investment in this space, and we like to see ourselves as your strategic partner. We just don't want to be viewed as a distributor that picks, packs, and ships product.
Yeah,
we want to be more than that, and we push ourselves to be more than that.
And I'd love to back up to the origins of Besse. How did this start out?
Yeah, so it started off as a corner drugstore over in the west side of Cincinnati that my grandpa started. He was a registered pharmacist. My grandma was a nurse. They built this pharmacy back in the 1940s. They lived above the pharmacy in an apartment. They had two boys, my dad and my uncle, who both became registered pharmacists. Both went to University of Cincinnati. Both ended up taking over the pharmacy. And I think as time goes by, they started to realize we have, being an independent pharmacist is tough, right? Like it's, even chain pharmacies are having a tough time. So they knew they had to diversify the business. My dad got into selling medical supplies literally out of the basement of the pharmacy because I'm one of four. So he got 4 mouths to feed, and he knew the retail wasn't gonna cut it. So he started dabbling in pharmaceuticals, not necessarily biologics. That was too early, but like diagnostics. Eventually, that led to like generic injectables. That eventually led to vaccines. So we became a vaccine distributor probably in the mid 90s, focused on adult and pediatric vaccine, like flu vaccine. We were one of the larger flu vaccine distributors that started in this little pharmacy, literally in the basement of the pharmacy. As a kid, I would go to school. I would come back and work in the pharmacy upstairs as a clerk. And then they would pull me down to the basement of the pharmacy to ship vaccine.
Oh my God.
So as a kid, I was
That's amazing.
This is like my life. I've seen the business go from those early days when we're kind of nimble and like just trying to grow. And then eventually we grew out of the basement, built a warehouse distribution center north of Cincinnati, really got into biologics at that point. So Remicade was the first specialty biologic that we started distributing in the early 2000s. But at that point, specialty had started to take off, and I think companies started looking at the opportunity to grow in the space. Steve Collis, who's now the chairman of the board of Cencora, at the time was running a company called ASD Healthcare, which was part of Bergen Brunswick.
Okay.
Bergen acquired us in 1998 under Steve's leadership, and we have been I guess what I would call the non-oncology multi-specialty distributor ever since.
That's an amazing like almost a rags to riches story. I mean, that is
it
really
was.
amazing.
It
Is
was.
the pharmacy still there?
The pharmacy's not still there. So when they sold to Bergen-Brunswick, they also sold the pharmacy to CVS, and we had a home health business doing like crutches and canes and walkers and wheelchairs. And we sold that to a local hospital, which is kind of sad because, but I've got a picture of the pharmacy still in my office. The early memories of growing up there and not living there, but growing up there and working there is still like, it's what I think drives us, even though we're part of now Cencora, because, Bergen-Brunswick became AmerisourceBergen when Amerisource and Bergen merged in 2001. And later we rebranded ourselves Cencora. But it's really important to me and my team that we still come across as a family-owned company. We still operate that way. We're still nimble. We want to take care of our customers. A good example of, I guess, what drives me is like, listening to my dad growing up. He would tell me stories about how he would work in a soda fountain. Like he was a soda fountain jerk, as he called it. And my grandpa would tell my dad, if the soda fountain or whatever, soda ice cream shop down the road puts 2 cherries on top, you put 3.
Yeah.
If they put 3, you put 4. And that's those little things growing up and watching my dad grind it out every day is what motivates me and drives me and my team to be better every day.
What would your grandfather think now?
It's, whenever I talk to my dad about it, he gets teary eyed because he gets emotional about just how he's seen the business grow. And I'm pretty sure he would be really proud.
Yeah.
Not necessarily proud of the entire family. It's not, I'm 3rd generation. I'm carrying on the legacy that was started by my dad, my uncle. Later, my cousin Mick took over the business as president, general manager. My brothers have been part of this company. My sister still works there. My cousin still works there. There's still Besse. Some Bessies have gone. Some Bessies have stayed. I'm just trying to carry on the family legacy and keep the ball rolling.
It's so meaningful for us to whenever we're getting our drugs from Besse Medical, to be able to know that I can pick up the phone and text or call Eric Besse.
Yes.
That you've got skin in the game. And
yes.
I think that makes a big difference,
yep.
At least from our perception. If anything goes wrong, you're going to go the extra mile.
100%. And that's how my team operates as well. We're all available all the time.
Yeah.
Because we want to make sure our customers are happy. It's the one thing I preach to my team more than anything is be responsive. Like immediacy is important. You may not have the right answer. You may not have the answer at all, but let them know you're working on it. And that goes a long way. So yeah, it's what drives us every day I'm of course passionate about, because my name is on the store, and the good days are great. The bad days can be really bad.
Yeah. Yeah.
But still it's fun. It's what I've grown up doing and hopefully can continue doing for, many years to come.
Let's talk about the structure of AmerisourceBergen.
Yeah.
So, or I should say now Cencora. It's rebranded.
Yep.
Where does Besse fall within the Cencora? I'm still having trouble changing to it. And why did they rebrand from AmerisourceBergen to Cencora?
Yeah, so I'll take that first. So Cencora is now a global company. Through mergers and acquisitions, we've acquired distribution operations over in Europe. And so one was Alliance Healthcare. So you had a situation where you had a big operation in Europe distributing pharmaceuticals, and you had AmerisourceBergen in the U.S. distributing pharmaceuticals. And, we've got operations literally in dozens and dozens of countries. So they wanted to come up with a brand, a name that was more universal. So it's a combination of being the center of healthcare, being the core of your business. Cencora actually translates to Cencora in every language. There's no...
Really?
Yeah, it's like it's like one of those words that there is no translation. It's just Cencora. So that's why we kind of rebranded ourselves. As far as kind of where we sit, so we sit within what we call specialty physician services. So if you look at our column within Cencora, it's Besse Medical, it's oncology supply, which is, obviously oncology. It's our GPO, it's our technology partners, Intrinsic. That's what we call SPS, or Specialty Physician Services. Outside of SPS, you have a team that focuses on health systems, very large health systems like Henry Ford.
Hospitals.
Yeah. You have a team that focuses on community and retail pharmacy. So Walgreens is one of our biggest customers.
Wow.
And obviously you have chains, but you also have a very large cohort of independent pharmacists that are very important to the healthcare ecosystem. So we want to make sure we're taking care of both ends of the spectrum. And then, and on top of that, we have animal health. We have a company.
Vets. You take care of vets.
Vets. Yeah. So they call it both companion and production.
Yeah.
But yeah, we have a whole distribution focus on, everything from cattle farms to the local vet taking care of, your dog or cat.
So Cencora is much, much bigger than just Besse. It's a whole cadre of technology, hospital services, physician services.
Yep.
You hit on technology.
Mm-hmm.
What kind of technology do you have that sets you apart?
Yeah. So, a couple of years ago, we made a big investment as a company to put all aspects of distribution, not just specialty distribution, but distribution on one SAP platform. We moved everybody to one e-commerce platform and then one, what we call CRM or customer relationship management software. It was a big project, and there was some bumps in the road, but we got through it. And the benefit though is now it doesn't matter if you're buying from me or if you're a health system customer or you're a pharmacy customer, you've got one account. You can order from any part of Cencora. Think of us as like, within Cencora, think of us as like the Amazon shopping experience. If you need a specialty drug, you can buy from us. If you need like med-surg product, or if you need, some kind of generic injectable that we don't necessarily stock in our DC, you can buy from another part of the business in another DC. Distribution centers, DC. And so like, that's kind of the blocking and tackling. You got to be able to obviously get product from point A to point B and do it really efficiently at scale. From a provider perspective, we've got a number of different solutions that we offer our customers, primarily inventory management. So we made a big investment. In fact, back in 2017, we launched Cubix MD. That was my project. Before I was in this role, I was running provider solutions, helped develop go-to-market strategy, Cubix. Later, we bought POTUS, which your office uses.
Can't live without it.
It's a great system. And yeah, so like, but it's more than just, you can't just be an inventory management platform. You have to, we look at our inventory system as almost like a office workflow support system. It's not just managing your inventory, but it's also making sure the inventory that you've used was billed for correctly. And we do that through our integrations with your practice management system, your billing system.
Yeah.
So we match up your billing records to what was dispensed to make sure everything was accounted for. That's at the end of the day. And there's other bells and whistles within our inventory management systems to help support Retina in particular, like intervals, right? So there's the 28-day rule where you can't inject the same patient, the same eye, less than 28 days, right?
So you guys keep track of that for us.
We have algorithms behind the scenes that will make sure that if one of your staff goes to inject a patient too soon, we will alert you. And we've even made adjustments for like EYLEA HD where there's a loading dose. Yeah. So like we focus. We get a lot of feedback. We have a lot of customers, a lot of users on the system. We've been evolving since 2017. And I think we do probably 8 releases a year. Each release probably has 4 to 5 features that get updated or released. And so it's a constant investment. It's one of the biggest investments we've made as a company.
I'll tell you, if nothing else, POTUS is just such a game changer for us. I mean, it ensures that we are not only able to get paid by the primary payer, but also the secondary payers. And we can track that the whole way through. Yeah. That has been such an unbelievable game changer. I can remember when we used to do this by hand.
Yes.
And keep track of drugs. And it was a disaster. And that was when we were seeing half as many patients with only 2 drugs.
Right.
So it's a huge endeavor that you've taken on. And it's the one thing beyond anything else that will keep us with Besse and Cencora is I can't imagine going away from POTUS.
So I appreciate those comments. And, we work really hard to make sure we don't sit back, and we constantly push and make sure, like, for example, we recently announced partnerships with PX Technologies, also Somacare, where we know our customers are using platforms outside of POTUS, for example, for tracking like prior auth or running prior auth for patients. So we're integrating with those platforms to bring the prior auth data into our ecosystem so that your staff, before they go to inject a patient, can verify that the prior auth is on file and it's still good.
Wow.
So again, like we know, because you guys are seeing so many patients and there's a lot of product moving in and out, that you have to have a scalable platform to ensure that everything's accounted for, and everything, like before you go to inject, you have verified you're not going to be, you are going to be reimbursed. You're not going to have any issues. That's kind of our focus. There's a lot of systems that manage inventory, but there's not a lot of systems that have the experience going back to 2017 and just listening to our customers and making sure we provide a good product.
You run a difficult situation where you're, in essence, kind of in between the physicians and the pharmaceutical industry.
Yep.
How do you balance keeping everybody happy?
That's a good question. You know, we all have our own objectives, and, you know, we call it upstream and downstream. So upstream, we want to make sure pharma is listening to the voice of the customer. And this is why we have this meeting, right? Like, you know, some of the work that Shane Dixon's doing to ensure that customers have a voice and pharma is listening. Like, what are the challenges? What are the reimbursement challenges? Are there contract opportunities that we can look at or work together? So we want to be really good partners to our pharmaceutical vendors. They rely on us for, obviously, I said, getting product from point A to point B, but it's also understanding the different market dynamics that are occurring. We're kind of they have obviously their own team, but we try to just echo what we hear from our customers. On the downstream side, our customers, yeah, listen, it's a highly competitive space. And it's why we push ourselves to be better every day, because we know there's others that are in the space that have their own offerings. We want to be the best at what we do. And so we really, again, whether it's inventory management, now we have lots of other solutions that we can offer. We have MIPS consulting. We have data analytics software that we can offer our customers. We have vendors and other solution vendors that are now in our ecosystem of GPO solutions that we can offer. Again, it's a physician should, when reviewing options, you know, if I were to make a recommendation to anybody, you know, find out who are you doing business with? You know, because at the end of the day, we're responsible for the accounts receivable. We're responsible for we essentially think of ourselves as a bank that is shipping product, because, you know, some of the products that we sell have 120 days, 180 days. So we're managing AR. We're making sure your staff knows when the bills are coming due, because they're so far out in advance. Make sure that, you know, find out how much continuity has been with the team over the years. Like, what's their tenure? I pride myself on, obviously, I've been in the company my entire life, but my team has been with us for, at a minimum, 15 years. So I try to create a really good culture that keeps people in, you know, working for our organization. Because you don't want manager of the month or rep of the month coming in and out. You want to know who you're calling. You want to build a relationship with that person, because we're there to back you up and take care of you.
Absolutely.
So those are the things we try. You know, obviously there's a lot of things that go behind the scenes when it comes to moving product, but at the end of the day, I want you to be able to call me or call my team and know that you're going to get an answer immediately.
What are you most excited about, Eric, in the future?
So I am excited about a number of different things. I would say the one thing that we've heard a lot of feedback on from the retina community is around sustainability and the environment. You know, so pharmaceutical distributors use what they call EPS, or styrofoam coolers, right? Yeah. Everything that we ship is cold chain. It has to stay between 2 and 8 degrees Celsius. There's a lot of work that goes into verifying our pack outs. But that said, as a consumer, I don't feel great throwing away styrofoam at home. And I've heard stories from our customers that, you know, they're getting extra dumpsters for our packaging, because we're shipping so much product out. They have so much patience, you know, and so a couple of years ago, I started pushing internally on, you know, we got to be better at this. We have to differentiate ourselves. Are there other more sustainable, recyclable coolers that we can utilize? And I'm happy to announce we're going to make that announcement today at this meeting, tomorrow at the meeting, that we are moving to a recyclable corrugated cooler that can be curbside recycled.
That's amazing. How much do you estimate that's going to save?
Oh, well, I mean, you know, EPS styrofoam takes decades to break down, right? And so, from a savings perspective, I think about all the time, money, and effort that my customers have to go through, either driving recyclable styrofoam coolers to a recyclable or a processing center if they can find one. It's not about the money, because these things aren't necessarily cheaper than an EPS styrofoam cooler, but it's the right thing to do, and we're going to do it.
I love, Eric, and this is a perfect ending to the interview. You start out talking about how your grandfather passed this down to you, and now you, in essence, are passing something down to the next generation by looking out for the environment.
Yeah. Well, yeah, and yeah, when you say it that way, you're right. I think more locally. Like, I want to help my customer, but when you take a step back and think, yes, it's going to have a really good impact to the environment. Like, at some point, I think we're all going to have to do it, and we wanted to be the first. I wanted us to be the first to take this leap of faith that we're going to move to a different shipper. We're going to focus on making sure the biologics are safe first and foremost, but we got to do it in a better way. So we're going to do it.
Fantastic.
Yeah.
Eric Besse, thank you so much for joining us.
Thanks for having me. It was a pleasure.
Absolutely.
Appreciate it. Yep.
John, I learned a lot from this interview. I was not really sure of Cencora's role in the ecosystem. I now have a firmer role of it. Same thing for Besse Medical. What was your impression of Eric after talking with him for over 20 minutes?
Well, it's not my first interaction with Eric. I've talked to him before, and I come away every time that I talk to Eric with just what a genuine person he is, about how honest he is. And with this interview in particular, what I really had a chance to learn more of is his ties to the company. Besse Medical is named Besse Medical because his grandfather started a pharmacy and then eventually evolved into equipment and then on to this distribution. And it really shows. I mean, he takes a great deal of pride in the fact that this was a family business that he's worked in from when he was a kid. And I think he's got great integrity. I think that it's clear the passion that he has for what he does and the pride that he takes in it. And so it's, once again, something that I've seen before with Eric, but I didn't know that backstory. And you could really just feel it sitting there with him, that conviction in his voice about just how much passion he has for this.
Knowing that from his perspective, they are not just a company that packages and ships product, or they're not just a company that is picking up a box and moving it over there, that they're pretty dedicated to the work that you and your colleagues do, I think was pretty clear. What role do you envision a company like Besse having for a practice that maybe isn't a Cencora practice but is coming into it? Like, what would be their first taste of working with a company like Besse Medical, and how might it change the way they work?
Wow. I mean, gosh, I'll tell you, if I was starting a practice right now, this would be the first place I would turn to partner. And I say that because they have so many different solutions. And some of the things we heard about were partners that they work with to actually help with the things that aren't just about shipping and handling and buying drugs. It's about contract negotiations. It's about staff employment and hiring solutions and just a variety of different things that you're going to need in place when you're starting a practice. So I would imagine if I was starting a practice, I would reach out to Eric or to Shane and say, hey, listen, I need this and this and this. Who can you hook me up with? Because they have connections. If they can't do it themselves, they know people who can. And by being a Cencora member, you actually get some benefits.
And like something like MIPS consulting, right? That could seem like it's a back burner issue, not something you really need right now. Next thing you know, without a MIPS consultant, you're taking a 2, 3, 4% hit in reimbursement. And if you had just had someone taking that care of for you already at the beginning, that would have been really useful.
Absolutely. That billing and coding. I mean, they had a billing and coding expert. We'll talk about the meeting in another episode, but they just provide a bevy of different services or have access to people, know the people that you need to know to get things done. So I think it was really great. And once again, if you're somebody who's out there kind of going, well, am I happy with my distributor? I would honestly look at Besse or Cencora and say, what are my options here, and what more can they offer us? I'll give one last thing, and this is probably the thing that we value the most, is they have a great drug inventory tracking system so that you can actually track your drugs, track it to the patient, make sure that you've not only gotten paid for your primary, but your secondary and any additional copays and whatnot that patients may have. So it's a phenomenal resource.
Well, John, thanks a lot for that interview. I think the audience found it insightful. I know I certainly did. Everyone, that is our episode. Thank you for listening. If you like what you heard, subscribe to the show. Visit retinup.com to sign up for our newsletter. That's retinup.com. If you're watching the show on YouTube, you're watching the video version, leave a comment and we might read it on the show. And we're doing a mailbag episode soon. So if you want to hear John's thoughts on anything that's related to your career, to the art of practicing medicine, to something just kind of related to retina, email a voice recording to info@retinup.com.